Hello, my name is Kevin Sun, and today for my topic I will be talking about SOPHiA GENETICS moves precision medicine ahead. So what is SOPHiA GENETICS? SOPHiA GENETICS is a Swiss-based analytics company that uses AI algorithms in a partnership of global hospitals to improve the treatment of cancer patients. At the time that the book was written, it operated in 215 hospitals in 35 countries. So moving on to the next part of my topic, what exactly is precision medicine? Precision medicine is a newer approach to medicine that fine tunes disease treatment for each patient, recognizing that every individual is unique in environment, lifestyle, and genetic makeup. This is especially helpful for patients that have breast, colorectal, and lung cancer, in addition to melanomas and various types of leukemia. Currently, at the moment, most cancer patients generally receive the same type of treatment as other cancer patients who have the same uh, type or stage of cancer as them based on a recommended standard of care given to all doctors. The problem is with this current treatment is that different patients have different responses to the exact same treatment. So how SOPHiA DDM works to alleviate this problem is SOPHiA DDM is a software as a service platform. Uh, to explain that, it requires hospitals to subscribe to their service and give a $50 to $200 fee per new sample that they upload to the program. They do this by uploading patients' DNA sequence files to SOPHiA DDM website. The software then identifies the patient's genetic code and suggests the best combination of drugs that treat their specific cancer based on historical data. The best part about this service is that using the service, healthcare professionals can get drug treatment recommendations within a day, compared to the normal process, which can take anywhere from 2 or even more days. So, what is the ethical dilemma here? The main ethical dilemma here is privacy. Uh, privacy that is based on your information as a patient. And what this entails is it a violation of HIPAA? When you give your information as a patient to a doctor, they are saying that they're not going to give it to anyone else, and it is just between you and them. So by giving your information to a third-party program such as SOPHiA DDM, uh, is this a violation of HIPAA where they're giving you your information to a third party that might possibly not be as secure as you think? You just have to trust that they are having a system that is equipped to handle your security concern and is encrypted enough to prevent other people from accessing your information. So what this entails is there might be a selling of information possibly. So recently on the news, there's been uh, cases where Facebook has freely given away your information to analytics companies uh, in order to gain a profit from it. This has become major news recently, and it's on the back of everyone's minds when it comes to personal information, especially sensitive information like your healthcare. In addition to that, there's the possibility of cyber attacks, such as ransomware that occurred in British hospitals, where their hospital infrastructure was locked down because of a cyber attack. These hackers might take your information without you knowing because they're attacking the hospitals and not you directly. Um, there's also the issue of accountability, where SOPHiA DDM may not possibly have known that they were hacked, and they can claim that they the hacking was from the hospital and maybe not from them as the source. Also, your information was given to a third party, uh, you might not have um, agreed to. Uh, this accountability factor is basically a big ethical dilemma based on who is to blame for losing your information. So moving on to the discussion questions. The first question, what advantages does the SOFIA DDM system have compared to the approach attempted by MD Anderson in a previous case? Which approach do you believe has the greater potential for success in the long run, and why? So a significant advantage of the SOFIA DDM system is the ability to use records from its vast network of hospitals and in several different countries. The AI attempted by MD Anderson in that case only incorporated data from one hospital and was limited by old records, and it was incompatible with being implemented with other hospitals. Furthermore, it became much too complex of a project by trying to find the reasoning behind the treatment application, whereas SOFIA only attempts to suggest the most statistically accurate treatment based on its current records. I believe machine learning and AI decisions is fully correlated directly to how much data and information it has access to. Therefore, SOFIA DDM has access to a much wider breadth of knowledge, and therefore it is able to make better decisions through a larger available data set. So the second discussion question, the creation of patient database stored among hospitals globally raises concerns about patient privacy. How might SOFIA DDM address this concern? I raised these concerns earlier in my ethical dilemma, but according to the official SOFIA Genetics website, they're listed as being HIPAA compliant and ISO 27001, which is Information Security Management certified. They claim that SOFIA DDM is a platform that's encrypted to the highest industry standards and then stored redundantly in secured and private data centers, taken directly from their website. Furthermore, the healthcare institutions remain controller of the data, keeping full ownership of them, and that the data is never disclosed, untraceable, and guarantees total transparency and security. For me, like all security concerns about IT infrastructure, there's still the possibility of the human element with maybe some health professional having a weak password or leaving their credentials somewhere that's being seen by someone else. So they could also be working on an infected computer with a virus on it that they might not know because it's undetected. But when it comes to patient privacy, it's very sensitive and personal information, and I believe SOFIA addresses these concerns as best that they can, based on what I've seen on their website, being a third-party software. So for the last question, do research to determine whether or not the SOFIA DDM technology improved patient outcomes, lowered costs, or provided some other benefit. Document your finding in a brief paragraph or two. So, according to my research, SOFIA DDM technology has improved to incorporate 60 countries and 490 institutions since this book was published. If you remember from my point earlier, it used to be 215 and 35. That's almost doubling in both categories, as well as doubling their number of genomic profiles to, I believe it was 227,000. A major partnership with DASA, the largest medical diagnostic company in Latin America, has allowed SOFIA to be deployed to the wider Latin America region in order to help alleviate their 1.1 million cancer cases and 600,000 cancer related deaths annually in the region. SOFIA DDM helps smaller hospitals in particular by minimalizing costs and allowing them to access a vast repository of data that they wouldn't be available to them normally. This sharing of data allows collaboration and gives all clients and clinics access to their database to use for cancer drug treatment. Lastly, here are the resources that I used, and thank you for listening to my presentation.